Well, good morning. It's Dr. Matt Harkness, and we are coming to you from our Allied campus for our Wellness Connection video. So thank you first and foremost for watching this, taking time to invest in your health. So this month's episode, we're talking about balance problems. So I want to talk about two types of balance problems. The first one is what we call positional vertigo. So this is a type that when you change positions, say maybe you roll over in bed or you reach down toward the floor and your head kind of goes toward your knees, and all of a sudden you have this rapid spinning. It feels like you're falling out of the sky. It's a horrible feeling, and a lot of times when you have this feeling, you'll get some nausea and some you start sweating, some perspiration, and it is quite scary. But I have good news that this is something that we treat as physical therapists, and it will definitely help you to come in and we can resolve this. The second type of vertigo is what we call vestibular weakness. So think of a very popular actor, Tom Cruise, and his spinning in jets and how he's going to save the day. And Tom Cruise has a vestibular system like Arnold Schwarzenegger's muscles, meaning he can handle spinning rapidly and it doesn't affect him at all. Now, sometimes with us, we do have a weak vestibular system, and so it kind of feels, it manifests itself in ways, for example, like when you're walking, you feel like you can't walk in a straight line. Or you feel like you're kind of walking on a boat. The floor is kind of moving, and you just feel like you just can't get your orientation, your footing, because you feel like you're off balance. And that would be something we call more vestibular weakness. Okay, so we reviewed two things. We had this positional vertigo, which is sometimes it's called when you have rocks in your ears, and that's when you have turn over in bed and there's rapid spinning. And then we talked about vestibular weakness, which is where your vestibular system, your inner ear, is weak and you feel unsteady. So there's a couple of ways that we treat these two conditions. For the first kind, yes, it is true that you do have, they're not rocks, but you have crystals in your inner ear that become dislodged, and there's little canals inside the tiny system in your ear, and those little crystals move around spontaneously without movement and cause this sensation of spinning. So first and foremost, when you have this awful feeling, it is important that you don't close your eyes and you focus on an object, because that sensation usually only lasts about 15 to 20 seconds, and then it will stop. You will kind of learn through trial and error how to kind of accommodate this stimulus by avoiding certain movements. And so when you come in, what we will do is we determine exactly what part of the inner ear is affected, and then we do some positional treatments to correct this, this sensation of dizziness by removing the crystals from the ear. So now let's talk about vestibular weakness. So vestibular weakness is more happens when you are, again, the system is weak, and a lot of times when you have the positional vertigo, you will also end up with some weakness in the vestibular system as well. So what we want to do is, in the case of vestibular weakness, we want to strengthen the vestibular system. So think of a muscle. So if you injure your arm and you don't use it for a while, the muscle is going to atrophy and it's going to get weak. So what we want to do is apply some resistance. Say you hold a weight and you stress the muscle begins to get stronger. So it's the same way with vestibular weakness, where we want to challenge you by introducing some exercises that are a little uncomfortable, just like when you lift a weight, it's uncomfortable. And we do some different techniques, kind of rapid head movements and spinning movements, just to strengthen your vestibular system. But once again, as like a muscle, when we use weight, it's difficult at first, but it begins to get stronger. Same with the exercises we introduce for the vestibular weakness. At first you feel like, I don't like this, but as we do it more, you begin to feel steady and solid, and you no longer feel like you're on a boat or you can't walk in a steady line. So, a few tips for both of these conditions. So, first and foremost, the positional vertigo generally happens most often during allergy season, believe it or not. And your sinuses affect your inner ear. So when you get sinus pressure and you might get some inflammation in your inner ear system, a lot of times that triggers positional vertigo, and we tend to get a lot of patients during allergy season. It is important to see a good ENT, that's ear, nose, and throat doctor, because they do want to rule out, is there maybe wax stuck in your ear? Is there an infection where you need some antibiotics? Or, do you need some sort of imaging to see if there's something else going on, such as a tumor or something? Having that been ruled out, a lot of times referring to or coming to physical therapy, we can get started right away and get you better. Okay, let's talk about the tips for positional vertigo. So, first and foremost, when you have this dizziness with the room spinning with position changes, don't panic. I know it feels terrible, but a few tips that you can do to make it a little less scary. So one is to be careful with rapid head positions. So turning over in bed suddenly or reaching down to the floor suddenly. Avoid those movements, because if you're just standing and upright, you will not have the positional vertigo. It's just with head movements, generally quick head movements. So avoid those. However, if you do have the sensation of spinning that is rapid, you do not want to close your eyes. Keep them open and fix your eyes on an object, say a picture, an outlet, or a light switch, and just focus on that object as you feel the sensation of spinning. And what will happen is your brain will tell you, okay, Matt, I'm okay. I'm not falling out of the sky. I can see the picture. Even though it looks like it's moving, my rational brain says, I am okay. And then, hold on to something as well. Also, another tip for positional vertigo is, yes, I would take some over-the-counter allergy medicine, even anti-inflammatory medication such as ibuprofen or Motrin, Advil will help. Of course, check with your doctor, check with the pharmacist. If you have any reasons that you can't take those medicines, don't take them. All right, tip number 2. This is for vestibular weakness. Okay, this is when you feel like you're unsteady, you feel like you're going to lose your footing. So the first thing I would say is it may be wise to use a cane just for a little bit of balance. Okay, so a cane will just kind of help improve your stability a little bit. So that would be a good tip to use until you get to the doctor, until you get to us here. Also, even just kind of avoiding large open spaces, without something to steady yourself on. So if you can steady yourself, say, kind of holding on to a counter or something, that will help as well. Also, another tip is when you look ahead, meaning you look kind of out to the direction you're going, down the path of the store or your house or the sidewalk, it is much better than if you look down at your feet. because you want to look out at the horizon. So like if you're on a boat and you are going, the boat is moving, if you look down at your feet, it's gonna be very hard to maintain your balance. But if you look out at the horizon, you can maintain your balance pretty well. So as you walk, don't look at your feet, look out ahead. So, last but not least, sometimes with either of these conditions, you can develop some pretty significant tension headaches and stiffness in your neck, because when you're dizzy, your muscles are kind of go into this kind of fight, protection mode, and they tighten up. So a lot of times we incorporate some good hands-on treatment to loosen up the muscles around the neck. So there you have it. We want to, help you get back to what you love and do it naturally. And so we love treating vertigo and dizziness, and we have a great facility here for it. So be sure, if you have these symptoms, give us a call. And of course, we can help direct you to a good ENT, or you might have already gone to an ENT and they have recommended physical therapy. So thanks for watching, and we look forward to getting you feeling solid, feeling like Tom Cruise, strong and able to fly those fighter jets and conquer the day.